The death of a 4-month-old baby boy earlier this month is highlighting gaps in a state program meant to protect children born exposed to drugs. Child advocates say the Comprehensive Addiction and Recovery Act, or CARA, is still failing families who need help. It's a story our 4 Investigates team has covered extensively. And just this year, Governor Michelle Lujan Grisham acknowledged those failures and vowed for change.
Too many families do not adhere to the spirit of that program. That's why I believe it's time to make these interventions mandatory.
4 investigator Brittany Costello joins us now. And Brittany, this is really a good news, bad news situation, because the good news is that state lawmakers delivered somewhat on what the governor requested this past legislative session. But the bad news is this is a problem that's going to take a lot of effort and a lot of time to really find a solution.
Absolutely. CARA is complicated. At its core, though, it says the state is supposed to step in at the hospital when a baby is born exposed to drugs. CARA requires the hospital create a plan of safe care. Essentially, it's a document with resources, then baby is sent home with mom. But participation is voluntary and follow-up is inconsistent. Our reporting has uncovered babies have died and overdosed after being sent home with drug-addicted parents. Because of that, the program is being reworked with a new lead agency. The Health Care Authority is taking over.
I think we're pretty ready to do it. I mean, we've been very involved in this program for a long time, and you're right. The piece that's been hard is that multiple agencies touch it and nobody is fully responsible beginning to end. And we have pretty good track record, I think, at Health Care Authority at standing up big programs, and we're pretty much ready to take it on.
So this bill also adds more requirements this time around. What are some of those changes specifically?
Right, and that's why we need this long transition period to figure that all out. But Chief Medical Officer Alana Dancis says major changes include universal screening for mom and baby, mandatory treatment for drug-addicted parents, and having a presence in all birthing hospitals. Dancis says the bill also requires a report to CYFD if parents don't comply, something that has not been happening for the last 5 years.
There's a piece where we are escalating to CYFD. Right. And so what happens then? Making sure, okay, you've escalated it, what's determined over there? We're not done with the story just because it's been escalated to a different department.
Now, I know you've also talked to some families who say treatment is difficult to access, especially if you live in the more rural areas of our state.
Absolutely. It's extremely hard, and Dancis admits they are going to have to get creative with those efforts. Healthcare Authority says it is working on building that network up, but she is confident they are going to make this program work for New Mexico families and, of course, these babies.
I think that the first bill focused on keeping families together, focused on mothers, which is an important piece, and I think this bill really sets the infant as the primary person in the bill. So these are the goal is to keep the infant safe, number one, and keep families together as possible, and that seems to be the right priorities.
A big problem over the years is not knowing how many children who are under a plan of care have died with that plan of care. Is that a metric you foresee tracking?
I don't know if that's like particularly one of the ones that we're looking at.
Do you need that data to know if it's working?
I think so. I mean, but we should know even if they're doing well.
The Health Care Authority has until July of next year to get this program off the ground, but Dancis hopes to get a firmed up plan by August, but obviously there's a lot to sort out.
Yeah, and that's still a lot to do, essentially a year away. So with that timeline, what happens until then? I mean, how do we know that there aren't other families, children falling through the cracks like this 4-month-old that just started another conversation? Right.
Dancis says that's one of the biggest challenges, maintaining a program while building a completely new one. So to answer your question, she says the CARE program will continue operating as it has, primarily under CYFD until then. Part of the challenge in our reporting is we don't know which New Mexico families have a plan of care. care. We've been doing our own tracking of families that would seemingly qualify for the program, and we've found in 2025 that number is around 60 across the state, a majority of those in Bernalillo County, and we're talking about families with multiple children. So it's a lot to consider. That's just from this year, as this takes time to roll out.
That actually seems kind of low.
Right, those are just criminal charges related to the exposure, the overdose, or the death. We don't know what CYFD's involvement is outside of those criminal cases.
Yeah, you guys you're kind of limited with what you can find out, but great job anyways, everything you guys have been doing. Thanks for the update on that. Sharp.